Hello, everyone. My name is Tiara Brooks, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled, Creating School-Wide Conditions for All Students to Thrive, Hallways to Health Webinar Series, Part 4. This webinar will describe the roles of funding, creating institutional policies and procedures, and formalizing partnerships and sustaining school-wide efforts. Jordana will share sample policies and strategies from Hallways to Health school-based health centers and provide tools to help SBHCs plan for sustainability. But before we begin, we do have a few housekeeping reminders. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the chat icon located in your Zoom toolbar. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. Let's begin using our chat box. If you are viewing as a group only, please go to the chat window in the chat icon and type in the name of the person registered and the total number of additional people in the room with you. For example, Tammy Jones +3. This will help us with our final attendance count. The School-Based Health Alliance is the national voice for school-based healthcare. We support school-based healthcare through technical assistance and training. We advocate for SBHCs on the federal, state, and local levels. We demonstrate the value of SBHCs with common standards, measures, data, and research. Our presenter today, Jordana Snyder, is a program manager at the Alliance and manages our Hallways to Health initiative. Now, I would like to again thank you everyone for joining us, and I will turn it over to our presenter, Jordana.
Thank you so much, Tiara. Our objectives for today will include participants will be able to identify the 3 elements of school-wide wellness sustainability, describe the benefits of school-wide wellness policies, and identify 2 electronic health records codes that capture social determinants of health and/or adverse childhood experiences. We introduced Hallways to Health as a model for school-based health centers taking the initiative to move beyond the clinic walls and to lead school-wide wellness efforts with the purpose of increasing health equity and creating conditions that promote health and enable all children to thrive in the classroom. Hallways to Health is a project of Kaiser Permanente Thriving Schools, who supported the development of this training as a part of their national effort to improve health of students, staff, and teachers in K-12 schools. Our Hallways to Health sites created programs, policies, and procedures to increase food security and healthy eating, neighborhood safety, creating safe and positive school climates, and addressing social determinants of health with restorative practices. Hallways to Health increased buy-in and engagement in school-wide wellness efforts from school-based health center staff, school administrators, parents, community-based organizations, youth, and even school employees. On our previous webinars, we talked about building wellness teams and discussed strategies to engage these partners. We talked about the importance of being involved in collecting school-wide data and using this data to plan school-wide wellness approaches. We looked at sample data and a sample action plan, and we found that Hallways to Health sites found that engaging these partners and in these efforts benefited their practices too. They increased school-based health center referrals and utilization. Now we're working toward national scale-up, and that's where you come in. We hope this part 4 of the webinar series will give you some of the tools and skills to be a part of this shift towards school-wide wellness. As in previous webinars, we wanted to share with you the general steps toward building a school-wide wellness program, which our Hallways to Health sites took to begin this cohort. They built teams, they engaged partners, they assessed their needs, they planned action plans and implemented programs and policies, and the last piece is sustain. So today we'll talk about sustaining your efforts. and provide some insights on how to keep your school-wide wellness efforts going or to expand them. Funding, partners, and policies all influence whether your school-based health center and your school can maintain or expand your school-wide efforts over time. Developing sustainability strategies to address these three components makes it possible for the school-wide wellness work to continue to grow and to improve. Policies and procedures can help ensure continuity as staff transitions occur and where there is potential to lose historical knowledge. In order to sustain your actions, you'll revisit your action plan. In order to sustain your work, you'll revisit your action plan, which we discussed on webinar part 3, and you can revisit in our archives. And you'll take a look at that action plan with a sustainability lens. You'll identify your partners, policies, and funds to ensure that your school-wide wellness efforts continue or grow in the future. Now, it's important to note that school-based health centers must have efficient clinical operations before thinking about moving beyond the clinic walls. And it's also important to note that as our Hallways to Health sites found, not all components of your school-wide wellness efforts will be sustainable. You'll have to revisit which are the most important to your students and your school community and plan accordingly. Let's hear from one Hallways to Health champion about her efforts to sustain her school-wide wellness efforts.
My name is Sarah Trivette, and I'm a physician assistant and certified health education specialist at Turner Elementary School-Based Health Center in Albany, Georgia. So my school is an elementary school in the inner city of Albany, Georgia. 100% of the students receive free and reduced lunch. We serve the vast majority of the students in the school as function as their medical home. Hallways to Health really became aware that school wellness, district wellness committee are important to help drive the work forward, especially, we're a small staff, and so we really need a wellness committee to make change in the school. So we've been very fortunate at Turner Elementary to have the support of our principal. She's on board, parent facilitator who really helps get parents on board. We have parents who come. We have students in our school wellness committee. We have a diverse range of people to try and help propel the work forward. So we have a school wellness team that helps at the school level come up with plans like we want to track at our school because those are things that we need, and these are the individual fundraisers that we're going to do. But then at the district level, because a lot of these things really require some district support as well, I've been able to be a co-chair of the district wellness committee. So yeah, we really tried to focus on policy change so that we could have sustainable change in the school, and one of the big things that we worked on was reinstating recess. So there's a policy now for the school that all kids K through 5 get at least 15 minutes of recess daily. It can't be withheld for punishment, remediation, or make-up class time. That was a huge change, as prior to that most students were not getting recess on a regular basis. We've also done a policy that in order to follow something called Smart Snacks guidelines, that you don't sell junk food to kids. So we thought outside the box when working with how to fund those. We have applied for an Action for Healthy Kids grant. We've applied for a state grant called SHAPE grant. We've also applied for a Fuel Up to Play 60 grant to help refurbish the playgrounds. We've been able to get a track built, and so we partnered with the school to find other ways to get funding for those things that needed to be done. And the School-Based Health Center would help write the grants, although a lot of times they were going through the school, and then through that we're able to get policy change. So some of the challenges that we faced with implementing sustainable wellness changes are that change is slow, knowing that even though change is coming slowly, not to be discouraged and to celebrate those small victories and then build on that. Without Hallways to Health and developing this school wellness committee, we may not have been able to make some of the same key partnerships with our administration and getting our administration on board, getting our school secretary on board. So we've really worked with integrating into the school so that we are, a key part of the school and really working as a partner with the school. The changes that we've made have really been quite sustainable, and we've been very fortunate to make a lot of these changes actually at the district level, so that not only the students at Turner Elementary are being impacted by the recommendation for recess and what foods we're selling them and things of that nature, but also kids throughout the district. And these are things that really, with just focusing on using a wellness team and having a group of committed stakeholders together without a lot of funding, really are sustainable. Continuing recess, it's just a matter of making sure.
Sorry about that.
About through Hallways to Health will continue and are quite sustainable and really can be expanded to include other schools down the road. We really just plan to keeping on with what we're doing, and there's no reason for a school wellness team to end, and having recess will certainly be something that is there for years to come for our students. Making sure that we're offering healthy foods instead of candy bars and other junk food is something that doesn't require continued funding, but requires a continued culture of health and wellness. We plan to be there for our students, our faculty and staff in that way, and I think everyone's really excited about the opportunities ahead to continue and expand on this work.
I loved how Sarah talked about partnerships, especially with the school and the district. How she talked about changing policies to impact not only the students in her school, but across the district and into the future. And she talked about a variety of different funding streams, including a variety of different grants that they sought out to be able to continue this work. So the first thing that Sarah touched on was partnerships, and that's the first ingredient for sustainability. Partners can connect schools with resources and expertise. They can provide supplemental services. Partners can also be useful in advocating for the continuation or expansion of your school-wide efforts. Partners can provide information and insight. They can lead to other partnerships and connections with other funders. And they can also help you acquire financial and non-financial resources to allow your wellness team to continue to work. Some of the partners required to sustain your work may be similar from those that you've engaged to get your school-wide wellness efforts going. And others may be different than those you use to kick off your school-wide wellness program. Just like when we thought about partnerships in the beginning, when we were designing our programs, you'll want to prioritize partners who have high levels of influence and high levels of interest in your school-wide wellness efforts. And just to note that some may be about funding and others may not. So some of your sustainability partners might include your school-wide wellness recipients or participants, so thinking about your students and your school staff. You might also want to think about organizations who have shared goals of school wellness, organizations like community-based organizations, food banks, before and after school programs. You may also want to consider stakeholders who oversee each of these individuals, so parent groups, school leaders and school district leaders, like school board. And many of these are groups we talked about engaging in the beginning, but you may want to have a different lens of how to engage them. Funders may also share your common goals with your wellness team. And this may be an opportunity for you to think about connecting with private foundations, with health plans, and even with Medicaid as a possible opportunity for funding some of your school-wide wellness or population-level interventions. Healthcare providers may also share a similar mission or goal. So hospitals, mental health centers, and even your school-based health center sponsor organization may be possible folks to engage in your sustainability efforts. So if you have any additional thoughts on who potential sustainability partners might be, who would influence the ability to keep this school-wide wellness growing, or to expand it or to replicate it, please feel free to use the chat box to name an individual or organization that could help you sustain these efforts. Who might have a vested interest in that? thinking about local family foundations that focus on children's health and advocacy. Organizations like YMCAs, your school-based health center sponsor, FQHCs, your school boards, parent-teacher organizations, all great examples. So after 3 years of Hallways to Health, where the sites tried on various different approaches, the funding for the sites and their health educators was coming to an end. But we didn't want to lose the valuable contributions and relationships and successes of the school-wide wellness efforts. So what we did is we worked with the Hallways sites to provide training and challenge them to institutionalize the efforts that they had created, school-wide wellness efforts, in order to create systemic changes, changing school norms, creating new policies and procedures that would outlive the grant funding, and maintain individual historical knowledge of the Hallways Health Initiative, and that would impact generations of students to come. So just like Sarah talked about the importance of creating policies, we wanted to be sure that our hallway sites were able to do this as well. And this is an important part of any school-wide wellness effort, sustainability. So policies and procedures are the documents to provide guidance and accountability to ingrain the school-wide wellness throughout your school culture. And then what codifying this does, codifying your work into policies and procedures, is that it creates long-lasting impacts both for your current and for your future student populations. One way to do this is to create memorandums of understanding. So basically contracts among your school-based health center, your school. Think about the roles of your medical sponsors and even formalizing the relationships with community-based organizations that you have working on school-wide wellness efforts. So memorandum of understanding, MOUs, they include the purpose and the scope of the partnerships. They articulate timelines, they assign joint responsibilities and roles, and they identify any joint policies or protocols. And what an MOU does is that it says who is doing what and who's responsible for doing it, and then provides the details of the agreement and operationalizes them in documents called policies and procedures. So here, I'm going to share some examples from a sample and memorandum of understanding between Seattle and King County Public Health and Seattle Public Schools. So the purpose of this MOU was to provide and coordinate preventative and primary health care services and integrate public health in the school system, as well as the school leadership, the school-based health center, and the educational professionals. It's important to note also that when thinking about funding is that this MOU and this work in Seattle between the public schools and the public health department were in part supported by a levy as well as the city's general funds. So I'm going to read the parts of the MOU that call attention specifically to the school-wide strategies. So as we talked about before, MOUs denote who is responsible for each different element. So some of the public health responsibilities in this MOU included consulting with the school system on student health and school program needs. And they were also responsible for evaluation and reporting on the health as well as the academic outcomes, kind of an aggregate, so thinking really about school-wide. One of the obligations of the health center was to provide the health education and health promotion, in addition to, of course, the other clinical and primary care services. But I'm just calling out here what's specific to school-wide and prevention level initiatives. The school here, again, is written into the MOU that the school agrees to actively promote and integrate the school-based health center into the school setting, and that the principal will act to denote a liaison from the school or to the school-based health center, and will take an active role in promoting this integration. So it's really interesting that that MOU spells out that responsibility of the school leadership to make sure that the school-based health center is integrated and therefore can do the job of health education and prevention to all the students in the school. This MOU also specifies that the parties will work together to create a task force to decide how to share population-based preventative services. So how to create a health education curriculum that aligns with the current K-12 school system health education framework. And then it also specifies that population-based preventative outreach, preventative services includes clinic outreach, clinic enrollment, screening and health screening and health campaigns throughout the school, group-based intervention like classroom and school-wide health education, health promotion, nutrition services, and disease prevention. So here again, you hear about all the types of possible school-wide efforts that are a responsibility that's shared between the school, the school-based health center, and the Department of Public Health. And one more thing is that it specifies that the health center should participate in these population strategies, but again, shouldn't take precedence over its primary care responsibilities. So that supports what we talked about earlier, where we said that your clinic operations really do need to be kind of set and established before thinking about how to take on school-wide wellness efforts. The caveat being, if you're thinking about opening a school-based health center, you can absolutely include this into your model to begin with. So in the chat box, feel free to answer, do you have any MOUs with your schools? Did they include anything about population or preventative health? And you'll see the final thing at the bottom is that this MOU also specifies that there be a data sharing agreement between the school-based health center and the school system. And if you're not sure if you have an MOU with your school, talk to your other staff in your SPHC and talk to your sponsor organization, because this is definitely a good thing to make sure that you're knowledgeable about as you're practicing in the school. So as the funding was sundowning, we definitely didn't want to lose the valuable contributions and relationships and successes of the school-wide wellness efforts. So we wanted to make sure that the policies that were there were generating systemic change and guaranteeing the conditions for wellness. Policies and procedures provide guidance and accountability to ingrain school wellness throughout your school culture. Codifying your work into policies and procedures creates long-lasting impacts for children in the current school and future generations as well. So many of you have wrote in the chat box that you do have an MOU with your 2 school-based clinics, and that's wonderful. If you don't have an MOU with your school, that should be something that your school-based health center should incorporate. And others of you are writing that you need to work on the wellness piece, however. So we're going to get to that in just a few moments about some examples of language that can be included to beef up your MOU or to beef up your policies and procedures. So policies are the what. They're a set of organizational rules and requirements for governing a process. They could be at the clinic level, they could be at the school level, or they could be at the district level, and they could even be determined by local legislature. Our hallway sites work to change school curricula to include social and emotional learning, meditation, mindfulness. They promise dedicated time for meditation and mindfulness each day, for yoga, for physical activity. Hallway sites also created new and updated infrastructures like we heard about in Sarah's video, like a track, classroom reflective areas, which we heard about a few weeks ago in Whiteford Elementary School, created staff wellness rooms, hydration stations, school gardens, and they worked on both the policies and protocols to support these infrastructures. Hallway Sites also instituted ongoing programs and practices like alternative breakfasts, healing circles, restorative justice initiatives, and fitness clubs. And they created the protocols to increase access to services by bringing in off-site or school-linked organizations onto school campuses to run things like support groups. And they also co-located school-based health centers with nurse offices and changed the clinics to be more accessible to both staff and students. So those were types of policies and procedures which our hallway sites worked on. Our hallway sites also worked on some clinical protocols. So many of them, I know we talked about food insecurity on our part 3 of the webinar, and many of them introduced or created protocols to screen for BMI in their clinic, to screen for food insecurity, protocols to gather parental consent, and protocols to refer students and families to other social services. And they also created protocols to enroll students in these school-wide wellness efforts like fitness clubs, after-school fitness clubs, participating in restorative justice efforts, and they even got permission for conducting school-wide screening and some risk assessments. So protocol is kind of really, procedure or protocol is really about the how, the step-by-step about how things happen. So even though clinical practices wasn't the focus of the Hallways initiative, many of these clinical practices were complementary to and enabled, some of these population level or school-wide wellness practices. And it was really interesting to see that many of the school-based health centers had shifts in the way they operated as a result of participating in this initiative. So as Sarah Trivette said in her video, and in training that she's done for Hallways sites and other Georgia school-based health centers as well, the more that you can write down, the more that can happen continuously as people turn over. Although there will be constant re-education and partnership building efforts, writing policy down will simplify this process. And this is an article talking about the policy changes that Sarah was alluding to in her video. And you can see that this article is talking about revamping the wellness policy, establishing a wellness committee, and then it also talks about creating policies for around nutrition. So although her video talked mostly about the policy for recess, it's important to note that her site also incorporated the nutrition elements. So what could be sold and provided food-wise during classroom celebrations, what could be sold at fundraisers, what could be sold, during and after school. And writing these policies down is also interesting because what it does is talks about the prevention element and the importance of that. So this talks about preventing children from getting sick and utilizing the school setting as a place to promote health. So this is a real cool paradigm shift and really illustrates what Hallways Health was able to do. So we often see our school-based health centers as providing vital safety net services to all our vulnerable youth. But if we think about our school-based health centers as being an advocate for wellness and a place to promote health, to teach children and to teach students and school employees healthy behaviors, then it's a really interesting new way to think about what school-based health centers can do. There were some questions earlier about types of policies or types of language to support the wellness piece. So Oakland Unified School District in California has an amazing wellness policy. And it includes each of these elements here: nutrition, gardens, physical education and activity, comprehensive health education, positive school climate, physical school climate, access to coordination of student health services, staff wellness, and assessments and communication. And I'll just speak for a few moments about some of the things that are different about this wellness policy that other wellness policies don't have. And we'll include this wellness policy in our Hallways to Health Toolkit, which will be launched in a few weeks. So you can use this as a model wellness policy to beef up your own. So their focus on nutrition includes the non-food recommendation as incentives. So if your students in your classroom finished an educational unit, instead of having a party that is food-based, maybe you give pencils or stickers or something like that instead. There's also a component that talks about requiring any competitive foods and classroom celebrations to have to abide by certain standards set by the district. And it talks about providing nutrition education in the classrooms, during after-school programs, and family events. So they're hitting all of their audiences with the proper nutrition education, and then making sure that the students and families are eating the right types of foods while in school grounds. The comprehensive health education piece is really interesting. It specifies that the health education should be used to build resiliency, foster knowledge, skills, and behaviors to help students lead healthy and productive lives. And then it basically talks about a health education curriculum that's research-based and age-appropriate. And then it also specifies that the district will make efforts to provide professional development so that teachers and staff can incorporate health education into their school day. It talks about positive school climate, where students have the right to safe and supportive school environment, free of physical and psychological harm, and specifies that the district provide a social and emotional learning curriculum for each grade level with the idea that it will prevent bullying and discrimination and encourage restorative justice practices. They also touch on staff wellness. So that's a piece that's often left off of most wellness policies, but it says that it will provide safe and supportive working conditions for the staff, and focuses on staff retention, and it also acknowledges providing provisions to be consistent with collective bargaining agreements. So this is a really wonderful wellness policy to model your wellness policies off of. And this is a really great thing to work with your school wellness team or school district wellness team to think about what you could change and what could kind of be beefed up. And there's a lot of really great stuff in here. We just wanted to provide you with a little bit more information so that when you take a look at this policy, you know what you're reading into. Funding is another important element of sustainability. It includes things like personnel budget items. And if you're having some of your school-based health center staff specifically dedicated to school-wide wellness efforts, thinking about their salary. It also includes things like indirect costs associated with staffing your school-wide wellness efforts. Finding funds for your school-wide wellness efforts will provide additional support to enhance your current programs and infrastructure. And it'll also help you be able to expand or replicate at your site or at other sites. Other sources of funding include donations, grants, like Sarah was talking about. And there's lots of resources for grants, for infrastructure, for programming, for education, et cetera. You can also think about allocated funds. Maybe universities have funds or grants. Schools and districts also sometimes have some unrestricted dollars that they could allocate towards school-wide wellness efforts. Many of our Hallways to Health sites, actually, specifically in California, have the ability to advocate for use of local county accountability dollars for school-wide wellness efforts. And your school-based health center medical sponsors could also allocate funds as well. So you can also think about funds to hire staff to run health education sessions, to run yoga sessions. One of our school-based health centers had a student competition where the students got Fitbits for tracking their physical activity. Things like funding staff wellness breakfasts, and things like building new tracks or playgrounds. All of these obviously require funding. And, most of our hallways sites used the stipend that they got as a part of the Hallways to Health grant to help fund a position. But it's really important to note that many of our Hallways to Health sites said although they had a dedicated health educator for these efforts, there is so much that you can do with the staff and the resources you already have. And working with your wellness team to kind of divide and conquer really will enable you to do a lot of these school-wide wellness efforts without additional funding. And the last thing that's on the slide is about payment reform. So payment reform in the healthcare landscape opens the door for reimbursing or investing in services that impact upstream factors that influence population health. So initiatives like prevention, health promotion, and medical care. And school-based health centers have a really wonderful opportunity to participate in payment reform. State affiliates and school-based health centers should understand the current innovations in their state and local communities because of the impact that these initiatives could have on school-based health centers. So because payment reform is tied to payment from healthcare payers, all of your school-based health centers should be billing Medicaid and other payers for the services that you provide, the clinical services, of course. But you should also be collecting data on the populations that you serve and the quality of care that you provide. So school-based health centers should be assessing, collecting, and tracking social determinants of health, things like food insecurity and homelessness, and adverse childhood experiences, things like parental separation and imprisonment of your patients. And where possible, if you can, the entire school population. So there are a variety of tools to collect social determinants of health and adverse childhood experiences. And some of those are already included in electronic health records. And you should check if your health records are able to do this. But for population health, there are a series of diagnostic codes, ICD-10 codes, called Z codes, which are all about social determinants of health. And here are just a few of the top Z codes that you should pay attention to. So you'll see there's a code for homelessness, a code for lack of adequate food and safe drinking water, a code for extreme poverty, and some codes also for adverse childhood experiences. Things like parental separation, divorce, abuse, absence of family due to military deployment. And you'll use these data to demonstrate the value of school-based health center services and your school-wide efforts to your patients, communities, to your partners, to your policymakers, and to your payers. These data are really important because they can demonstrate improved health outcomes, and they can make a case for the type and amount of payment that payers should be providing to school-based health centers. It can also lead to maximizing billing and reimbursement. And in our toolkit, we'll also include a tool with some of our top social determinants of health, adverse childhood experiences, and enabling services codes, like the ones here, which you should be paying attention to. So now that we've come to part 4 of our webinar series, we've talked all about the achievements of Hallways to Health. We've discussed the conditions necessary to bring about this fresh approach. School-based health centers as hubs of prevention and wellness. School-based health centers as catalysts for school-wide wellness. And we've learned that it takes the following key ingredients to drive these changes: partnerships and collaborations, school and district level committees that make decisions about school programs and policies, assessing conditions for wellness and making the plan, so conducting school-wide needs assessments and designing public health action plans, focus on policy and system change, which we talked about today, making sure that we're changing discipline, physical activity, recess, and nutrition policies to make our schools healthier for students and employees, and thinking upstream that has allowed our Hallways to Health sites and your sites to make a long-term and sustainable impact and a change in the school culture as well. And then thinking about other elements of sustainability. So thinking about funding, thinking about partnerships and formalizing them, and thinking about how you can grow your school-wide wellness efforts. So we hope this webinar series taught you all about the Hallways to Health model, schools as the center of prevention and wellness, with school-based health centers as catalysts to serve a broader school-based health audience. What are your commitments or immediate next steps for school-wide health in your sites? Please check 1. I commit to one of the following. Wonderful. I see that a lot of you are committing to sharing the information from this webinar and this webinar series with someone from your school-based health center or school. I'll just remind you that all of our, this 4-part webinar series will be archived on the School-Based Health Alliance website. And that's a place where you can listen to the other webinars in this series as well. So that addresses most of the folks in the poll. So this is just a snapshot again of our sustainability section of our toolkit. So it's just a preview of what the toolkit will look like. And again, each section of the toolkit will have some introductory text, as you see in the blue box, some best practices like you see in the purple box. And you'll be able to expand each of those to get a little bit more information. So you would click on the plus sign. Each would have tips like the ones you see here. Each section will also have stories from our Hallways to Health sites, videos from our Hallways to Health sites, and specific tools and templates from our Hallways to Health sites as well. We'll look forward to sharing our Hallways to Health toolkit with you in just a few weeks.
All right, thank you so much, Jordana. We now would like to offer this time for you to enter your questions into the chat box. We would like to give you some time to enter those questions. So while you're doing so, we do have a few announcements. We ask that you join us by becoming a member. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. Please take a moment after the presentation to please visit our website about more information regarding our membership and joining. Also, please join us at our 2018 National Convention in Indianapolis, Indiana, from June 24th through the 27th. As the premier national gathering for our field, the convention is a fantastic opportunity to connect with hundreds of fellow school-based healthcare professionals and advocates from across the nation. Also, Jordana will be presenting at our pre-conference on June 24th on promoting schools as hubs of wellness, the Hallways to Health model. She'll be joined by Mandy LeBlanc from Washington School-Based Health Alliance in introducing the Hallways to Health Toolkit's key steps to using the population health approach and provide tools, resources, and examples to help SBHCs build, assess, implement, and sustain these efforts. Also join us for our upcoming Learning Collaborative and motivational interviewing that will kick off as a free pre-conference to all center programs, also on Sunday, June 24th. We also have our Be the Change Youth Training Program. Each year, students from across the country come to network with each other in school-based healthcare advocates and participate in various workshops pertaining to health, education, policy, and leadership. More information is available on our website and scholarships are available. Again, please join us for our 2018 National Convention. I would now like to open it up for any questions that you may have. Again, please enter your questions into the chat box. Okay, again, I would like to offer this opportunity if you have any questions. If you happen to think of any questions later, please email us and we will definitely forward our questions to Jordana. But we do have a few poll questions for you. If you please take a moment to answer these evaluation poll questions.
We're going to bring back up the evaluation poll questions. Give us 1 minute. Okay, we're about to launch our polling for evaluation questions.
And if you can please take a moment, we do have questions such as, does this presentation meet your needs, meeting the stated objectives, and also did the presentation provide usable ideas and techniques that are relevant to your work? And how likely are you to apply this information from this presentation in your organization? And once again, you can continue to enter your questions and we will try to answer them right after this evaluation. Great, thank you everyone.
Thanks for the great questions. Someone asked, are there sample MOUs available in the toolkit? And absolutely there are. The sample MOU that I shared from Seattle and King County Public Health and Seattle Public Schools is available in the toolkit, as well as a few others. Both general about school-based health centers and schools, and others that point to school-wide wellness.
Once again, are there any more questions that you have? You can also, once again, email us right here, and you email Jordana directly at jsnyder@sbhforall.org. And we'd like to thank everyone. And again, thank you, Jordana. This was an amazing series. And our toolkit will launch in a few weeks, and we will be sending everyone out an email. Again, we thank you and have a wonderful day.